My name is Crystal Hernandez, and in today's presentation, we will be presenting to you the proper patient education that is recommended for patients with autism. Our patient, George, is a 15-year-old male who was diagnosed with autism spectrum disorder. Autism spectrum disorder refers to a broad range of conditions characterized by challenges with social repetitive behaviors, speech, and nonverbal communication. We know that there's not one autism but many subtypes, and each person with autism can have unique strengths and challenges. A combination of genetic and environmental factors influence the development of autism. Um, some advice for dental professionals in the dental office would be to develop a relationship with your patient with autism, speak in a calm and soothing voice, get down to the child's level and be confident and reassuring, and do not ask the child if they want to come with you, but rather gently tell the child what you are doing next, and also be consistent. There's also some recommendations to prepare for the dental visit, and one of them is that you may want to prepare your child before going to the dentist. For some children, a visual schedule can be helpful to let them know what will happen throughout the visit. And this is somewhat what a visual schedule will look like, and it gives steps to the patient so that they can understand the direction from the dental professional. And it would start by putting hands on the stomach and then putting their feet out straight, opening mouth wide, holding mouth wide open, counting the teeth with the mirror, taking x-rays, and then cleaning the teeth and spitting it into the sink. This visual representation will help the patient have a feeling and a visual of what is going to happen during their dental appointment. So now I will have my classmate, Markia Hamlin, demonstrate and provide the basics of patient education for a patient with autism.
When working with autistic patients, each patient will be different, which is primarily based off of the patient's level. So, for example, a patient can have or be a mild or severe case of autism spectrum disorder. Severity symptoms dictates the appropriate settings for the delivery of dental care services. For this particular case, George, he is a mild case of autistic spectrum disorder. One of the main things to consider with any and every patient that is autistic is to have a desensitized plan, which basically includes the autistic patient coming in days before his actual appointment, for him or her to observe the office, the staff, and the equipment, and the actual room that he will be in. You want to make these appointments short and positive. You want to keep dental instruments out of the sight of the patient, as well as lights. That is one of their triggers, so you definitely want to avoid that. You pretty much just want to have a calm environment as much as possible. And you want to stick to a routine. That is like the most important thing with dealing with patients like this. Anything that's out of that routine that they may be used to can also cause a trigger. So it's important to keep a routine with these patients. You also want to do a tell, show, and do method. So if you have like um, any visual things in your operatory to help, will definitely be beneficial. So say if you have a typodont in your operatory, you can definitely use that. And here you can just pretty much display the tell, show, and do method to the patient as well as the caregiver. So here we have the typodont, and you'll just take your toothbrush here and just pretty much tell them about the VAS technique to the caregiver and or the patient. And you pretty much just want to go over your VAS technique, telling them about the 45-degree angulation, and the importance of keeping a pattern when brushing your teeth to prevent any missed surfaces. You also want to demonstrate the flaws, the original flaws, by placing that in the actual teeth and doing the seesaw motion, much forming a C shape on each tooth so that they can floss. If that does not work, we also have different alternatives for the patient if they can't get the original approach right. So we have the floss holder, and as you can see, it's pretty long here. This will definitely be beneficial for the patient. If the patient has dexterity problems, you can definitely use a tennis ball and just attach it to the floss holder or the manual brush and the electric brush as well. And that pretty much just helps them grasp the device that they're using and just help them with their brushing techniques. You also want to, with these patients, talk about fluoride, just because they do eat a lot of sweets in their diet, just because they're being rewarded. So pretty much sweets is given to them often. So you want to talk about fluoride and the benefits of that. You also want to include an antimicrobial rinse that would help them, as well as sealant. So anything that would prevent them from any dental caries is what you will want to talk about. And with the fluoride gel, paste, fluoride varnish will help. Those things would definitely help that patient. Also, you can tell the caregiver when they are giving that patient sweets to make sure the autistic patient is rinsing their mouth out with water. That would definitely help to prevent any dental caries. Yeah, so that's pretty much it. Like I said, you just want to make sure you have a short and positive appointment with the patient as much as you can, and just kind of reward them if they're doing good throughout the appointment. Just praise them, reward them. You can give them a sugar-free candy at the very end of the appointment, however you want to do, or a stuffed animal that they like that, depending on their age. Yeah.